Hello and welcome to another episode of Health Matters on Channels Television. We are delighted to have you join us, and I am Mary Alale Yusuf. In 2015, approximately 85% of children globally received a dose of the measles vaccine in their first year of life through routine health services, an improvement over the 73% recorded by the World Health Organization in 2000. According to the health body, in the period between 2000 and 2015, the vaccine prevented about 20 million deaths, which represented a 79% fall in measles deaths. In spite of this achievement, measles is still one of the foremost causes of death in children. The world recorded over 134,000 deaths in 2015. That's about 367 every day or 15 every hour. My guest today is Dr. Emeka Ugu. Dr. Ugu is a consultant pediatrician and pediatric cardiologist at the Reddington Hospital in Lagos and a fellow of the West African College of Physicians as well as the National Postgraduate Medical College of Nigeria. You are welcome to the show.
Thank you very much.
Let's start by finding out what really is measles anyway, and what does it look like?
Measles is one of the viral infections that cause rashes on the skin.
Okay.
So there are several names for measles. Some call it rubella.
Rubella,
Yeah.
different from rubella.
Different from rubella, exactly. They are closely related. Maybe in the course of the discussions, we'll look at the differences between the two of them. Measles characteristically has the patient, usually a child, coming down with fever first, then rashes, then cough with catarrh and conjunctivitis.
Is it in that order that it happens?
It should, yes. That's one of the criteria for the diagnosis. Actually, in the case of rubella, for instance, you will notice that the rashes would happen first.
Okay.
Before you have a kind of low-grade fever, or they may happen at the same time. But in measles, you would have the child come down with high-grade fever, very high-grade fever, and about 3 days after the fever, the child would develop rashes.
How about the red eyes and the...
There's no particular order in the emergence of those other ones, but they will come usually earlier because there are different phases. The conjunctivitis usually will happen around the prodromal phase, when you're having high-grade fever, the mother is still not sure what it is. Yeah. But when rashes break out, that's actually when the symptoms begin to go down, begin to wane, and then the child will recover. Okay,
I'm imagining a mother, who sees her child with a fever, high fever. Okay, so she first tries to tepid sponge, maybe gives some paracetamol, and the next thing she's seeing red eyes. Oh, red eyes! Then she goes to get eye drops. And then before you know it, the child is coming down with maybe rashes. I read something about white spots in the mouth. Well, I assume that a mother might look into her child's mouth at that age, 0 to 5, and perhaps see white spots.
Yeah.
But in all this time is going by, and I'm wondering, how dangerous is this with all this time going by?
Well, the issue of the white spots, they call those white spots Koplik spots. They are found in the mucosa of the mouth, the lining of the mouth, around the molar area, the premolar and the molar areas.
Are they readily visible to an untrained eye?
Yeah, but the problem is that within 24 to 48 hours they disappear. Actually, okay. Once the rashes begin to appear, the Koplik spots disappear. So it's very important, especially for the healthcare provider, to look for the Koplik spots. But of course, we don't hold any mother for not seeing the Koplik spots.
Okay.
So because the Koplik spots actually is pathognomic, is very important in diagnosis of measles.
So that's really particular
about
to the measles.
Yeah. So when a healthcare provider sees a child having fever, high-grade fever, and then sometimes you consider, is it malaria or is this child having an infection, and then you check there's no malaria, and then you look at the count sometimes, the blood count. Usually what happens in measles is that the white count will even go down, because if you expect the child to have an infection, the white count should come up, especially if it's bacterial infection. But once you see that the white counts are going down, especially lymphocytes are going down, and then the child is having high-grade fever, the healthcare provider should look into the mouth.
for those Koplik spots.
Yeah, exactly, in our environment.
And once he sees those Koplik spots, he has a diagnosis.
Yeah.
Okay, but what about before the mom goes to the hospital? The child is not yet with the healthcare provider. What should be her red flag?
Her red flag for a mother, for instance, is the mother should be concerned if there's anybody in the environment that has measles. Because in our environment, for instance, what is important is clinical diagnosis. Laboratory diagnosis is really not recommended for places where measles is still rampant, is still endemic. So in areas where they're already trying to eliminate it, it hardly happens. They can try to do laboratory tests. But here, it's actually the clinical features that we should be looking at. So once the mother knows that someone around them has measles and the child develops fever, which is high grade, she should have that suspicion.
High grade fever, so she should take her child over to
that's
the
a red
hospital.
flag.
Who is most susceptible or most at risk of having measles? What kind of people?
Most importantly, the children under 5 years, and then people above 20 years also, and those who are immunosuppressed, people who have low immunities, and those who are malnourished also. Children who are malnourished, and malnutrition is very common in our environment. Up to 52% of most health morbidities and mortalities are associated with malnutrition. So,
is that because malnutrition would probably reduce immunity? Is that the connection?
Yeah, that's the connection. That's the connection.
So malnourished people, how about age, old people, young people?
Young people, less than 5 years, especially less than 2 years, and then those who are more than 20 years old. So that's why it's recommended actually that children should have measles vaccination before they turn 1.
Okay.
In the environment in Nigeria.
What really is the age? Is it a flexible thing, any time before 1 year old?
Like in some countries, in Nigeria, our recommendation, the protocol for Nigeria is at 9 months. But in some countries, like in the US, they would give at 12 to 14 months. Okay. But in our environment, because it's very common in our environment, we give at 1 year, before 1 year, that's at 9 months.